Question 1. What is the most critical step in flexible endoscope reprocessing? A. High-level disinfection. B. Sterilization. C. Manual cleaning. D. Automated reprocessing. Answer: C. Manual cleaning. The concept tested here is the foundational importance of manual cleaning in endoscope reprocessing. The keyword critical highlights that this step is paramount because without thorough manual cleaning, biofilm and organic debris can remain, preventing subsequent disinfection or sterilization from being effective. Imagine trying to wash dishes with food still stuck on them. No matter how hot your dishwasher gets, they won't truly be clean. All channels and surfaces must be meticulously brushed and flushed as per manufacturer's instructions for use, IFU. Always remember, if it's not clean, it cannot be sterile or highly disinfected. Question 2. What is the primary reason for performing a leak test on a flexible endoscope? A. To ensure the scope is ready for sterilization. B. To detect damage to the insertion tube or internal channels. C. To verify the functionality of the light source. D. To confirm the scope's ability to transmit images. Answer: B. To detect damage to the insertion tube or internal channels. This question focuses on the purpose of leak testing, a vital step in endoscope reprocessing. The keyword primary reason points to the most important outcome of the test. A leak test, whether wet or dry, is crucial for identifying any punctures, tears, or compromises in the endoscope's exterior or internal channels. Finding a leak early prevents further fluid invasion and costly damage during cleaning and high-level disinfection, and most importantly, protects the patient from potential infection risks. Think of it like checking a tire for a slow leak before a long drive. You want to find the problem before it causes a bigger issue. 2. Question 3. What is the recommended method for transporting soiled flexible endoscopes from the procedure room to the decontamination area? A. In an open tray on a cart. B. In a clear plastic bag with visible contents. C. In a rigid, covered, leak-proof container labeled with a biohazard symbol. D. Hand-carried by a technician in scrubs. Answer: C. In a rigid, covered, leak-proof container labeled with a biohazard symbol. This question addresses the safe transport of contaminated flexible endoscopes, a key aspect of infection control. The concept is about containing biohazards and preventing exposure. The keywords recommended method and soiled flexible endoscopes emphasize the need for strict protocols. A rigid, covered, leak-proof container ensures that biohazardous materials are contained, preventing spills and protecting healthcare personnel and others from exposure to bloodborne pathogens during transport. For example, a designated transport cart with a securely latched lid would be used. Always remember to use proper containment to keep everyone safe when moving contaminated items. 3. Question 4. What type of water should be used for the final rinse of flexible endoscopes after high-level disinfection? A. Tap water. B. Distilled water. C. Sterile water. D. Deionized or filtered water. Answer: D. Deionized or filtered water. This question tests knowledge about the quality of water used in the final steps of endoscope reprocessing, which is essential for preventing recontamination. The concept is preventing the introduction of microorganisms or mineral deposits. Using deionized or filtered water for the final rinse minimizes the risk of introducing tap water contaminants like microbes or minerals, which could lead to biofilm formation or damage the delicate channels of the endoscope. This step ensures that the scope remains as clean as possible before drying and storage, helping to maintain the integrity of the high-level disinfection. Think of it as rinsing your car with spot-free water to avoid water spots. Question 5. What is the main purpose of drying flexible endoscope channels after reprocessing and before storage? A. To prevent the growth of microorganisms. B. To make the endoscope easier to handle. C. To remove any residual cleaning chemicals. D. To prepare the endoscope for sterilization. Answer: A. To prevent the growth of microorganisms. This question assesses the critical importance of drying endoscope channels. The concept is about preventing microbial proliferation. The phrase main purpose highlights that residual moisture, even after high-level disinfection, can support the growth of any surviving microorganisms or waterborne pathogens, potentially leading to patient infections. Thorough drying with filtered air prevents this growth and helps maintain the integrity of the reprocessing cycle. Think of it like leaving wet laundry in the basket; it will quickly develop mildew. 1-4. Question 6. Which of the following best describes a single-use medical device? A. A device that can be reprocessed and used multiple times on the same patient. B. A device designed to be used on one patient during a single procedure and then discarded. C. A device that requires high-level disinfection after each use. D. A device that can be sterilized and reused on different patients. Answer: B. A device designed to be used on one patient during a single procedure and then discarded. This question defines the term single-use in the context of medical devices, which is a fundamental concept for safe reprocessing practices. The keyword single-use is the direct clue. These devices are explicitly labeled by the manufacturer to be used once and then disposed of, meaning they are not intended to be reprocessed or reused on any patient, even the same one, due to risks of cross-infection or malfunction. Reusing a single-use device can compromise patient safety and lead to legal liabilities. Always check the manufacturer's instructions for use and the device labeling for proper identification. 5. Question 7. What is the term for the process that removes all visible soil, organic material, and foreign material from a medical device? A. Sterilization. B. Disinfection. C. Cleaning. D. Decontamination. Answer: C. Cleaning. This question defines a fundamental step in the reprocessing cycle. The concept is about the initial physical removal of contaminants. The keywords removes all visible soil, organic material, and foreign material directly describe the purpose of cleaning. Cleaning is the essential first step that physically removes debris, which is necessary before any disinfection or sterilization can be truly effective, because disinfectants and sterilants cannot penetrate through gross soil. For example, rinsing a surgical instrument under water to remove blood and tissue is cleaning. Remember, cleaning is about removing stuff, not necessarily killing all microbes. Question 8. When performing manual cleaning of a flexible endoscope, what is the proper technique for brushing channels? A. Brush only in one direction, from distal to proximal. B. Brush only in one direction, from proximal to distal. C. Brush back and forth through the channel until visibly clean. D. Brush until the brush appears soiled, then stop. Answer: C. Brush back and forth through the channel until visibly clean. This question tests the practical technique for manual cleaning of endoscope channels, a critical step in removing bioburden. The concept involves mechanical action for thorough soil removal. The keyword proper technique emphasizes adherence to best practices. Brushing back and forth ensures that all surfaces within the channels are adequately scrubbed to dislodge and remove organic material and biofilm, which can adhere tightly. Continue brushing until the brush comes out visibly clean, indicating that the channel is free of debris. Think of it like cleaning a drinking straw. You need to scrub thoroughly to get everything out. Question 9. What is a key challenge in reprocessing robotic surgical instruments compared to traditional instruments? A. They require higher temperatures for sterilization. B. They are typically single-use devices. C. Their complex designs and internal mechanisms make cleaning difficult. D. They cannot be processed in automated washers. Answer: C. Their complex designs and internal mechanisms make cleaning difficult. This question addresses a specific challenge related to reprocessing advanced surgical technology. The concept is recognizing the unique complexities of new instrument types. The keyword challenge points to a hurdle in the reprocessing process. Robotic instruments often have intricate joints, lumens, and delicate components that make accessing all surfaces for thorough cleaning extremely challenging, increasing the risk of residual soil and biofilm. This complexity necessitates meticulous manual cleaning and often specialized reprocessing instructions from the manufacturer. It's like trying to clean inside a complex machine versus a simple tool. 6. Question 10. Which type of flexible endoscope is most commonly associated with challenges in reprocessing due to its elevator mechanism? A. Colonoscope. B. Gastroscope. C. Bronchoscope. D. Duodenoscope. Answer: D. Duodenoscope. This question focuses on a specific type of endoscope known for its reprocessing difficulties. The concept being tested is understanding unique challenges presented by certain device designs. The elevator mechanism is the key structural clue. This unique feature on duodenoscopes, also known as ERCP scopes, creates small, hard-to-clean crevices that can harbor microorganisms, making thorough cleaning and high-level disinfection particularly challenging and increasing infection risks if not meticulously reprocessed. This design requires specialized brushing tools and strict adherence to manufacturer's instructions. Question 11. What is the term for a chemical process applied during instrument manufacturing that provides a corrosion-resistant finish by forming a thin, transparent oxide film? A. Polishing. B. Forging. C. Passivation. D. Tempering. Answer: C. Passivation. This question tests knowledge about the manufacturing process of surgical instruments, specifically how they achieve their corrosion resistance. The concept is the protective layer applied to stainless steel. The keywords corrosion-resistant finish and thin, transparent oxide film describe passivation. This process uses a chemical bath, often nitric acid, to remove free iron from the surface of the instrument, allowing a protective chromium oxide layer to form, which helps prevent rusting and pitting during use and reprocessing. For example, without proper passivation, a new instrument might rust quickly when exposed to moisture. 7. Question 12. What action should be taken immediately after a flexible endoscope has failed a leak test? A. Discard the endoscope immediately. B. Continue reprocessing as usual, but note the failure. C. Remove it from service, tag it as defective, and send it for repair. D. Attempt to repair the leak in the decontamination area. Answer: C. Remove it from service, tag it as defective, and send it for repair. This question addresses the immediate protocol for a critical reprocessing failure. The concept is defect management and patient safety. The keywords failed a leak test indicate a breach in the endoscope's integrity, meaning fluids could enter the internal components, causing damage and harboring microorganisms. Using such a scope would compromise patient safety. It is imperative to remove it from service immediately, clearly label it, and send it to a qualified repair technician to prevent further damage and ensure it is not used on a patient. This is like a red light on a car dashboard, you stop and get it fixed. 2. Question 13. What is the correct way to handle power surgical instruments during reprocessing? A. Immerse them completely in enzymatic solution. B. Disassemble them as much as possible and wipe external surfaces. C. Sterilize them immediately without cleaning. D. Place them directly into an ultrasonic cleaner. Answer: B. Disassemble them as much as possible and wipe external surfaces. This question focuses on the specific handling requirements for power surgical instruments during reprocessing. The concept is protecting delicate internal components from fluid damage. The power surgical instruments keyword is key, as these devices often contain electrical or pneumatic components that can be damaged by immersion in liquids. Disassembling and carefully wiping external surfaces as per manufacturer's instructions helps prevent fluid invasion into the handpiece or cable, which could lead to malfunction or patient injury. Always remember, fluids and electronics generally don't mix, so avoid immersion unless the IFU explicitly allows it. 8. Question 14. What is the purpose of using an automated endoscope reprocessor, AER? A. To perform manual cleaning of endoscopes. B. To sterilize all types of endoscopes. C. To automate the high-level disinfection and rinsing of endoscopes. D. To detect leaks in endoscopes. Answer: C. To automate the high-level disinfection and rinsing of endoscopes. This question assesses understanding of the function of automated endoscope reprocessors. The concept is about mechanical aid in reprocessing. The term automated endoscope reprocessor itself indicates its primary role. AERs are designed to standardize and automate the high-level disinfection, HLD, and rinsing phases of endoscope reprocessing, which helps ensure consistency and reduces human exposure to chemical disinfectants. While they are a vital part of the process, it's important to remember that thorough manual cleaning must always precede AER processing. 9, 10. Question 15. What should be done if a flexible endoscope is visibly damaged during the inspection process? A. Continue with reprocessing and note the damage. B. Attempt to fix the damage with available tools. C. Remove it from service and tag it for repair. D. Use it for a non-critical procedure. Answer: C. Remove it from service and tag it for repair. This question highlights the proper action when a flexible endoscope shows visible damage. The concept is maintaining device integrity and patient safety. The keywords "visibly damaged" are the clue, indicating a compromised device. Using a damaged endoscope could lead to patient injury, ineffective procedures, or further irreparable damage to the scope. It is crucial to immediately remove it from service, clearly tag it as needing repair, and send it to a qualified service technician to ensure proper function and patient safety. Never try to fix instruments yourself if you are not trained to do so. Question 16. What is the acceptable temperature range for the decontamination area in central service? A. 50 to 55 degrees Fahrenheit, 10 to 13 degrees Celsius. B. 60 to 65 degrees Fahrenheit, 16 to 18 degrees Celsius. C. 70 to 75 degrees Fahrenheit, 21 to 24 degrees Celsius. D. 80 to 85 degrees Fahrenheit, 27 to 29 degrees Celsius. Answer: B. 60 to 65 degrees Fahrenheit, 16 to 18 degrees Celsius. This question tests knowledge of environmental controls in the decontamination area. The concept involves maintaining optimal conditions for safety and efficacy. The keyword acceptable temperature range refers to the regulated environment needed to minimize microbial growth and discomfort for staff working with soiled items. Keeping the temperature within this cooler range helps to prevent the rapid drying of organic matter on instruments and reduces microbial proliferation, which could make subsequent cleaning more difficult. Think of how a refrigerator slows down food spoilage. A cooler decontamination area also helps control contaminants. 11. Question 17. Which of the following is considered the point-of-view step in instrument reprocessing? A. Sterilization in the central service department. B. High-level disinfection in the endoscopy suite. C. Initial cleaning and moistening of instruments in the operating room. D. Final inspection in the sterile storage area. Answer: C. Initial cleaning and moistening of instruments in the operating room. This question focuses on the crucial first step of instrument reprocessing. The concept is about immediate care after use. The keyword point of use refers to actions taken right where the instrument was used, typically in the operating room or procedure area. This immediate cleaning and moistening helps to prevent blood and organic debris from drying onto the instrument, which makes subsequent cleaning much more difficult and can lead to biofilm formation. Think of it as rinsing your dinner plate right after eating to avoid caked-on food later. 3.12. Question 18. Why is it important to keep flexible endoscopes moist after point-of-use cleaning and during transport? A. To enhance the effectiveness of sterilization. B. To prevent the formation of biofilm. C. To reduce the need for manual cleaning. D. To accelerate the drying process. Answer: B. To prevent the formation of biofilm. This question addresses the reason behind keeping instruments moist after their initial use. The concept is bioburden management. The phrase "important to keep flexible endoscopes moist" and the keywords "point-of-use cleaning" highlight the prevention of organic material from drying and adhering to the surfaces and lumens of the endoscope. Dried bioburden creates a protective barrier for microorganisms and makes the subsequent cleaning and disinfection processes significantly less effective, often leading to the formation of difficult-to-remove biofilm. It's like letting mud dry on your shoes. It's much harder to clean once it's caked on. 3.12. Question 19. What is the significance of channel integrity in flexible endoscope reprocessing? A. It refers to the cleanliness of the outside surface of the scope. B. It ensures the scope can be fully immersed in cleaning solutions. C. It means the internal lumens are free from breaks, blockages, or damage. D. It indicates the flexibility of the insertion tube. Answer: C. It means the internal lumens are free from breaks, blockages, or damage. This question defines a critical aspect of flexible endoscope condition. The concept is the structural soundness of the scope's internal pathways. The keywords "channel integrity" refer specifically to the undamaged and unobstructed condition of the narrow internal tubes, lumens, through which air, water, suction, and instruments pass. Maintaining channel integrity is paramount because any breaks or blockages can trap bioburden, prevent thorough cleaning and disinfection, and potentially lead to patient infection. Think of it like a perfectly clear, unbroken pipe. Any crack or clog will cause problems. Question 20. What is the recommended method for inspecting the insulation of laparoscopic instruments? A. Visual inspection only. B. Tactile inspection only. C. Visual and electronic insulation testing. D. Submerging in water and checking for bubbles. Answer: C. Visual and electronic insulation testing. This question focuses on the proper inspection of specialized surgical instruments. The concept is ensuring the safety and functionality of laparoscopic instruments that use electricity. The keywords "inspecting the insulation" and "laparoscopic instruments" are crucial, as damaged insulation can lead to patient burns during surgery. Both visual inspection for obvious cracks or wear and electronic insulation testing are necessary to detect microscopic defects that are not visible to the naked eye. This comprehensive approach helps ensure patient safety during minimally invasive procedures. 2.9. Question 21. Which type of stainless steel is generally more corrosion-resistant and non-magnetic, often used for items like retractors and cannulas? A. Martensitic, 400 series. B. Austenitic, 300 series. C. Ferritic, 200 series. D. Duplex, 500 series. Answer: B. Austenitic, 300 series. This question tests knowledge of different types of stainless steel used in surgical instruments. The concept is material properties and their application. The clues, more corrosion-resistant and non-magnetic, point directly to austenitic stainless steel, also known as 300 series. This type of steel is softer than martensitic steel and is preferred for instruments that require flexibility, corrosion resistance, and do not need to hold a sharp cutting edge. For example, bowls, basins, and many retractors are made from this material. 7.13. Question 22. What is the primary purpose of an enzymatic detergent in the cleaning process of flexible endoscopes? A. To act as a high-level disinfectant. B. To remove stains and discoloration. C. To break down organic matter like blood and tissue. D. To sterilize the endoscope. Answer: C. To break down organic matter like blood and tissue. This question asks about the specific function of enzymatic detergents in instrument cleaning. The concept is chemical breakdown of bioburden. The keywords enzymatic detergent and primary purpose are key, as enzymes, like proteases, lipases, and amylases, are biological catalysts that break down complex organic materials such as proteins, blood, lipids, fat, and carbohydrates, tissue, into smaller, more easily removable substances. This breakdown is crucial for effective cleaning, especially in hard-to-reach areas like endoscope lumens. Think of how laundry detergent with enzymes helps remove tough stains from clothes. 11. Question 23. Why is proper documentation of flexible endoscope reprocessing so important? A. It is only required for billing purposes. B. It helps track inventory levels. C. It provides a legal record of each step, ensuring accountability and patient safety. D. It helps predict future equipment failures. Answer: C. It provides a legal record of each step, ensuring accountability and patient safety. This question emphasizes the importance of meticulous record-keeping in reprocessing. The concept is accountability and patient safety through traceability. The keyword important directs attention to the overarching reason for documentation. Proper documentation creates a comprehensive, retrievable record of every step an endoscope undergoes, from patient use to cleaning, disinfection/sterilization, and storage. This record is vital for tracking potential issues, identifying sources of infection, and demonstrating compliance with standards and regulations, ultimately safeguarding patients and protecting the facility legally. It's like keeping a detailed logbook for every journey an item takes. Question 24. How many times should instrument marking tape be wrapped around a surgical instrument for identification? A. Once. B. 1.5 times. C. 2 times. D. 3 times. Answer: B. 1.5 times. This question tests a specific detail regarding instrument identification. The concept is proper application of marking tape for durability and cleanliness. The phrase "how many times" is looking for a precise number. Wrapping the tape approximately 1.5 times around the instrument ensures it is securely attached without being too bulky, which could interfere with cleaning or create a harbor for debris. Too much tape can trap soil or peel easily, while too little might not stick properly. Always ensure the tape is applied smoothly to a flat, smooth surface of the instrument. 14. Question 25. What is the general rule for using loaner instrumentation in a healthcare facility? A. They can be used immediately upon arrival if they appear clean. B. They must be fully reprocessed upon arrival, even if labeled sterile. C. They only need a quick wipe down before use. D. They should be returned to the vendor immediately after surgery without reprocessing. Answer: B. They must be fully reprocessed upon arrival, even if labeled sterile. This question addresses the handling of instrumentation brought in from outside sources. The concept is ensuring sterility and patient safety for all incoming devices. The term loaner instrumentation is the key. Facilities cannot guarantee the reprocessing standards of external vendors, so to ensure patient safety and maintain control over the reprocessing process, all loaner instruments must be thoroughly decontaminated, inspected, prepared, and sterilized or high-level disinfected according to the manufacturer's instructions upon their arrival, regardless of their stated status. Think of it as always washing clothes bought from a store before wearing them, even if they look clean.